Hello and welcome to the final session of our week on systems innovation, stepping into systems innovation. My name's Charlie Leadbeater. I'm joining you from the Rockwall Foundation in Copenhagen, the host of this initiative. We would love to have all of you here with us, of course, in Copenhagen, but we can't. But just to give you a little flavor of Copenhagen hospitality and warmth, I'm going to light my candle for you and leave that burning behind me. And just to locate me territorially, I'm going to put my Danish flag in my flower pot there, so you can see I really am in Denmark, although I'm based most of the time in London. So this is the final session of this week, and we want to try and bring everything together. We are interested in systems because systems are so powerful and important. We rely on them the whole time for transport, for energy, for water, but also for education and for health. And here at the Rockwall Foundation, we're particularly interested in social systems, education, health, care, systems that affect work and well-being. And the reason we're interested in those systems is that we think that not only do they face some really entrenched challenges, particularly around entrenched inequality and disadvantage, they're also facing new challenges of aging, mental health. And so we need to think about the future of these systems in a systematic way, to think about them in the whole. And what we're interested in here is the question of how people deliberately set out to change systems. We know quite a lot about how systems have changed. We're interested in how people deliberately set out to change systems. And so as a result of that, we're very interested in practical knowledge. We think there's a lot of systems thinking, systems theory, systems mapping. What we think is often missing is the practice of changing systems, how people actually do it. So we want to try and fill that gap. And so this week we've been trying to bring together people who excel at that, at trying to change systems in a thoughtful and reflective way. But we're not just interested in challenges or problems, we're interested in how those open up opportunities, how you can move from problem to opportunity to create entirely new kinds of systems. And so today we're going to hear the absolutely amazing story of Dr Sania Nishtar from Pakistan, who transformed a huge problem into an incredible opportunity. And we're going to listen to her story, I hope, in the setting of the frameworks that we've been trying to present to you, to see how her story illuminates those frameworks. So we'll come on to that in a second, but first of all, just to get a sense of who is in the room today with us, this is the last of 5 days, I'm going to bring up this quick poll that we can do together. So very simple, a few questions. Were you here earlier in the week, or are you entirely new today? Are you logging in from which part of the world? And then 2 questions about the relationship between systems innovation and the COVID-19 pandemic. In your field, has COVID-19 brought the opportunity to create new systems? Has it opened up that opportunity? And have existing systems coped well with the pandemic? So I'm just going to give you about another 15 seconds to register your vote. We're getting up towards the number of people in the session voting, and we will in 5 seconds reveal the answers. Anton, if you could do that for us now, we'll shut it off there. So quite a few people, 15% are new today, but quite a few people have been with us all throughout the week, which is great. Thank you very much for that. Most, as usual, from Denmark and North America, but a smattering from other parts of the world, Asia and Central America. which is great given the time differences involved there. 81% of people think that COVID has brought the opportunity to create new systems. So that will be an interesting finding to explore as we go through. And 56% think, however, that existing systems have coped reasonably well. So there's a sense, marginal sense there, that existing systems have coped reasonably well, but it nevertheless opens the opportunity for new systems to be created. So let's leave that there just to let you know that we are going to be interacting with you, we hope, in a variety of ways. We have a graphical recorder working with us as usual, Carlotta, who is in Sweden, just over the bridge. And we won't see Carlotta, but we will see her work. And at the end of this session, we will send you a digital copy of her drawing. You can see it. There she is. She's saying hi. Hi, Carlotta. Great to have you with us. We will record this session and we will make that recording available to you so you can listen back to it at your leisure. And if you go down to the chat button down below, you can find all the relevant links for social media, hashtags for downloading our green paper. And we are going to introduce earlier than normal the Padlet, which is our bulletin board. And we're going to invite you through a link that we'll post in the chat to make your reflections on the Padlet. And I'm going to explain now how that's going to work. So if we could just go to the overhead camera next to me. What we've been trying to do this week is work out the application of these three very simple kind of models. And what I want to suggest is that we listen to this interview with Sania Nishtar that we're about to play with these three models in mind, to try and explore whether these three models help explain what she's doing. And the first model is what we call our three levels model, which comes from the work of Frank Giels at Manchester University. And Frank's account of systems innovation and change is that there are three levels. There's the macro, the landscape, the context in which the system operates. There's the system itself, the regime, which is in the middle here. And then there are niches in which new things emerge. So one of the questions about Sania Nishtar's story is, how did she engage these three levels? And on the Padlet, there'll be a particular section for you to record thoughts and comments about that. Did she engage all three? Was one more particularly important than the other? The second thing that we have introduced is this idea that there are four keys to systems change: power, purpose, resource flows, and relationships. And one of the things we've been exploring is how systems change when these get broken up and reconfigured in new kinds of ways. So one question will be, well, how did those four keys play a role in her story? And which triggered the change and which opened up the opportunities for other things to change. And then finally, we talked about the different roles that were involved in systems innovation. And we have identified 12 roles, but we're particularly interested in a few core roles, I suppose. The entrepreneur who opens up the system, the insider-outsiders who work within the system, but they're opening it up to change, the conveners who bring things together, the investors who enable the new system to come into being. So the third thing is just to think about the roles that are in play when you hear her story. We had to record this interview. We hope to have a live, but we had to record this interview with Sania Nishtar earlier because she'd been called away. She worked for the Prime Minister of Pakistan, who had called her away to do something in a rural outpost in Pakistan, and not unreasonably, she thought that talking to him was probably more important than talking to us. So we don't have her live, but we do have her on tape. And this, I'm just going to draw you a picture of what it's going to be like listening to her story, because it starts with when COVID came to Pakistan. Now, obviously, there's a backstory to what happened before that, but it starts with what happened when COVID came to Pakistan. And when she starts talking, it sounds quite detailed. There's a lot about identification numbers and mobile phone numbers and bank accounts and things like that. And it seems to go on like that. And then it goes like this. And then suddenly it goes like that. And at the end, and you have to listen right to the last few minutes to get that explosion, it is absolutely amazing. And so what we've been used to in this pandemic is we've been told about spikes, right? Spike in the virus. And what this story is about is when a spike in the virus equals a spike in social creativity. Because what Sania Nishtar is about to tell us is a story about how crisis can lead to a spike in social creativity. So without further ado, I am going to introduce you to Sania Nishtar, and this is we're going to play in the conversation we had earlier. She was based in Islamabad, and I began by asking her what the situation was like in Pakistan when COVID came and the country went into lockdown.
So when COVID came, the focus was on the health aspect, and I understand why the focus on the health aspect was important. But there was this impact on the livelihoods of people, which I think did not get the attention that it deserved. And this was not a Pakistan-specific phenomenon, it's a worldwide phenomenon. To cite our own example, we are the 5th largest country in the world in population terms, the 5th most populous country in the world. Our current population is above 200 million. And in this country, there are 24 million breadwinners whose livelihoods either depend on earning daily wages, or they earn on piece rate, or they are self-employed in Pakistan's very large informal economy. So 24 million breadwinners is a very large number. If you multiply it with our family size, the household size, you come to about 160 million. So 2/3 of the country's population was essentially deeply and direly struck as a result of the lockdowns that were imposed, which were understandably an imperative. Now, when that happened, people who earn daily wages have no fallback. They earn a daily wage, they take things home, and that's how they put food on the table. And when COVID struck, 2 weeks into the lockdown, we could see deep unrest palpable on the streets. And I recall my colleagues calling me and saying, how fast can you do something? Because there's palpable unrest. You know that in Pakistan, there's a huge culture of giving and philanthropic giving. So anybody who had disposable income, could afford, would make bags of ration, carry them in their cars to places where laborers are likely to congregate. And I would get consistent phone calls saying that our cars are attacked. There are so many people out on the street in need of food rations. So the country was virtually on the verge of civil unrest 2 or 3 weeks into the lockdown. Me and my colleagues were very mindful of the huge responsibility we had to execute a program, to do it quickly, to do it and to fashion it in a demand-driven fashion.
So you at that stage, you were given a kind of big budget to do something. Just describe what that was. And then I guess the problem of getting the money to the people in question who are doing daily work. They're informal labourers. They're not people who regularly visit banks or are used to going to social security offices.
So the government of Pakistan had a fairly wide-ranging approach to in terms of the economic response, and different ministries were given different budgets. We were given a budget initially of 144 billion, later increased to 203 billion Pakistani rupees, which amounts to about 1.25 billion US dollars. Our mandate was to give cash transfers to those who were in distress at the bottom of the pyramid. And as you said, these are individuals who are daily workers, who are daily wagers, who are inevitably illiterate. They've come from very far-flung areas, from villages. They live in cosmopolitan towns. And these individuals were essentially trapped in these very large cities. Because of COVID, inter-provincial, inter-city transport was suspended. They couldn't go back home. They were essentially stranded in large cities, and they had no fallback. They had no way to eat. So luckily, the digital payment system that we had invested in creating over the last year, as I explained to you, subsequent to the official pronouncement of the SARS program, there was fast-track work rolled out to develop the institutional architecture. And we picked up all the pages from the book, so to speak. So as part of the infrastructure, we had developed a data analytics mechanism, and that was one part of what we threaded. The other part was a request-seeking mechanism. So even last year, I wanted to roll out a demand-based request-seeking mechanism. And I recall these extensive Blackboard discussions that I had with my colleagues. And I would say, we have a 16-digit unique ID, we have different databases. Why not ask people of Pakistan to raise their hand, SMS us their 16-digit number? We'll have this hit different databases. We will come up with a list at the end. Let's widen the net of assistance. We have the money to do that. And this was last year. But my colleagues thought this was too ambitious. It was too out of the box. It was too daring. And while they agreed that it would work, there just was not the appetite to do something so out of the box. But when COVID struck, I pulled those leaves out of the scrapbook, so to speak, and I said, we have to implement it. It is not an option for us to just pick up a list from a database that was developed 10 years ago and say, this is what we have, take it or leave it. That would have been the safe option to do. This was a very daring thing to do. And the moment I announced, and so the data analytics, the request seeking was one part of it, and the payment system was the third. So we had to kind of thread through and sequence these things.
But just to be clear, what you did was you asked people to use very basic mobile phones to send in their unique identification number to an analytics machine that sifted them through to see if they were eligible for the payment. So it was a very simple, but it was essentially a digital solution. And people in their millions must have sent you SMS messages.
So we designed it for simplicity. There's a very small percentage of the population in Pakistan that has access to smartphones. So we designed it in such a way that individuals with feature phones could access it. And even if they don't know how to write, they know what their 16-digit identification number is. So we massively advertised. We asked people just to SMS us their 16-digit number. Now, people understood it very well. Of course, we ran into problems because in the first week when I went out and met a group of laborers. A lot of them told me, we don't have credit on our mobile phone, so we had to make that SMS number free. A lot of them said, we don't know how to SMS, we only know how to receive a call. So there were those issues, but by and large, there was massive uptake. We received 139 million applications.
Wow.
139, but then a lot of the numbers were not legitimate. There were errors, there were missing numbers, there were lots of duplications. So there were 66 million unique numbers, which is still more than, it's about 30% of the people raising their hand. And once the SMSs arrived, they would get an acknowledgement. Now, when the 16-digit number would dive into different data servers, and if it was the government employment data server, they would get an immediate notification, you are not eligible. And because we had the ability to tie the family together, if the spouse texted, the spouse would get a message, your spouse is a government servant, you're not eligible. And then it would go into the taxation database, into the car ownership, into the land ownership, into the immigration database, and so the telephone. And there was a lot of work that we had to do to assemble, to set the ceilings. And I had to explain layer by layer to different entities within the government what I was going to do. I had to explain to people within the government, I had to explain to the cabinet, I had to explain to other organs of the state what was happening and what was the basis of that execution. But until, sorry, go ahead.
So you had to bring government together and merge, or at least align these databases, and you had an AI engine that was sifting these SMS, and you had to do all of this really quickly because it was urgent.
We had to do it quickly, yes.
Yeah, so an urgency was a key factor in getting all these people to collaborate. And then you sent an SMS to the eligible people saying how they could receive their payment, which I think was $75. And often these would be people presumably without bank accounts. So how did that, once you decided you'd found the right people, itself a huge undertaking, how did you then let them know that they could pick up their money, and how did they actually collect it? And how did you make sure the right people were getting the money?
So once we did the data analysis, we texted them back. So we picked the book, there's a way to configure a SMS when you pick the names and their ID numbers with bookmarks, and you text them back saying you are eligible to receive cash, but you can receive your cash on such and such day, because this was a COVID environment, so we couldn't risk throngs and very long lines. They did happen at places, but we sequenced the payments. So the SMS went back to them. They took their cell phones to the payment sites. Now, in terms of your question, how were the payments made? So there were commercial banks were our partners, and we had already brought them on board through a competitive selection process. And our payment system was so designed that each individual had a limited mandate, a current account, and then a savings account. So when we authorized a person as deserving and eligible for our grant, prior to sending them an acceptance notification, we would send their identity card number to our partner banks, who would do a know your customer check on them, because there are all kinds of security lists. So they would do a know your customer check, send us a okay, and open an account for them. So when the person would go to the bank ATM or to a branchless banking retailer, and when they would put their finger, take their biometric, the account would automatically open when the biometric was authorized by our database registration authority. Wow. So the account was automatically opened. They would withdraw the money. Now going forward, we will even provide them the option of a savings wallet. So if they want, they will have the option after the biometric either to withdraw the money or to move it in a savings wallet and then do whatever they like to with that money. But during the emergency, we did not enable the savings wallet. We just asked them to take the cash and go because the savings wallet feature was not possible in the emergency.
Yeah. So it sounds like creating that kind of system normally would have taken months of papers and agreements, and you managed to do this, I think, in a matter of weeks. And how many people have now used that system to get these very small micro payments?
So we've made payments to 15 million families. And it required a lot of joining the dots because we knew that the standalone capabilities existed. And it was a question of joining the dots and getting the different agencies to work together. I mean, I'm slightly digressing, but just to tell you a story, I worked in the government for the first time in 2013. And when I stepped down, it was a caretaker role. It was an interim minister's role. When I stepped down from the government, I published a paper in the Lancet, basically downloading my reflections as a federal minister. And one of my takeaways was that in order to develop a solution, you have to draw on different competencies from the government. I mean, the solution in the health or in the social protection education sector does not sit within the confines of that ministry. But I wrote in that paper that the government, we think the government is one entity. It is not one entity. It's an archipelago of different institutions that have a disincentive to collaborate. That's how governments work all over the world. Right. So the trick was to get the stakeholders together to design a system, making sure everybody understood their role and had an incentive to participate.
Right.
And the ability to then execute quickly through, tracking and monitoring and whatever else it took.
Yeah, and I just want to underline so that I've understood and the people listening have understood. So it took collaboration within government to pull together different departments, but it's also collaboration with commercial banks. Must have been collaboration with the mobile phone operators who crucial to that infrastructure. You had non-bank cash retailers who were in effect small shops, and I think you also had to engage provincial governments in changing the regulations on some of these transactions. So it took the orchestration of all of that inside outside government, and your agency, which had been created in such a thoughtful way, managed to pull that off. Just two final thoughts then. One is, what do you think is the future of this digital infrastructure, and particularly your relationship with the non-government bits of it, because the mobile bit of it seems so important. Do you think that's going to be a continuing and important bit of your social protection programs?
So your question is the future of the digital infrastructure and how we draw on the space of mobile telephony. So I think that is a very important component of SRs, because one of the most empowering things that has happened in countries like ours is mobile phone ownership. Because if a poor family owns a mobile phone, especially a smartphone, then the world opens for them. They have access to information, they can access services, a variety of different services. They get very empowered, relevant to our work. They can tap into government assistance. They can They can save. So the mobile phone is a very central piece of SARS. And in fact, when the SARS strategy was launched last year, we had an initiative called the One Woman, One Bank Account initiative, predicated on the understanding that access to mobile phones, to digital wallets, to savings capability, of course, if you make the right financial literacy investments, that's a prerequisite. And if you make the right financial literacy interventions and access to phones and all the capabilities that the phones bring would be hugely empowering for poor families. So, so the SARS cash payments which was of course a product of a couple of weeks' work. SARS cash payments in the COVID context, I would say, was just a tip of the iceberg. It was an illustration of what is possible. If you are willing to push the envelope, if you're willing to be a bit daring, if you have the imagination to map out how individual pieces in an ecosystem can gel together to deliver in a systemic way. Yesterday, I was in a UNDP conversation, and I wanted to outline that there are. So the digital landscape has brought a lot of commercial standalone solutions, but when you knit together those standalone solutions, then the sky's the limit in terms of what you can deliver. And what we did in COVID was just a small illustration of that.
Thank you so much, Dr. Sania Nishtar, for sharing that story and that glimpse through crisis, like a portal into a different possible world that COVID has suddenly opened up. This is actually what it could be like. And it's so impressive, both what you've done in such a short time, but also this orchestration of all these different capabilities and competencies together around that. And it's truly inspiring to hear about how you can reach so many millions of people so effectively and so quickly, and a reminder that government is such an important orchestrator of that kind of creativity. I've been sat here thinking that this is a bit like listening to William Beveridge talk about the foundation of the welfare state in Britain in 1945 or 46, because it sounds to me like this is the basis for a completely new approach to social protection and the possibility of welfare. So thank you very much indeed for sparing the time to talk to us.
I'm very honored. Thank you very much. And I hope this will be the first of many conversations.
Thank you so much.
Thank you, and bye.
So that was Dr. Sania Nishtar, who I was speaking to earlier. Now, just to give you a moment to reflect on that, and I think it's been a little bit difficult to get our Padlet thing working properly. So there is in the right hand at the bottom of your screen a Q&A function where we put a little question, and just add there any reflection that you've got about what you've just heard and what it's left you feeling. And the question we've put there is, what do you think are the most important ingredients of that? But just to give you a moment, just the highlights of that: 24 million wage earners whose households have 160 million people were at risk of losing their livelihoods. Sania Nishtar was given a budget of $1.25 billion and created this mobile system, which then had 139 million SMS messages sent to it, which they had to sift through. They found 60 million of those were clean, if you like, they were appropriate, and they had to sift through to the 15 million to whom they had to send the money. And then for many of those 15 million people, they had to create bank accounts so that the money could be put into the bank accounts. And when the people came to open the bank accounts, they had to provide their biometric data. So there had to be a biometric system which identified them. And I just want to pick out a couple of the quotes she gave us, which I thought were amazing. And this is all recorded. You can go back to this later, share it with people. We think of government as one entity, but government is not one entity. It's an archipelago of different institutions with disincentives to collaborate. Governments are like that all over the world. She talked about this program to get this money to 15 million people as the product of a couple of weeks' work. I mean, most small projects in government take months. This was a program to get money to 15 million, and it was the product of a couple of weeks' work. And then right at the end, when she said, this is just the tip of an iceberg. It's just a small illustration of what is possible if you're willing to be daring, bold, and when you can get the individual bits to knit together into an ecosystem. So those are really powerful ideas. And I'm now going to be joined by my colleague, Jenny, and we're going to just go through these and pick things up, hopefully, from the chat and the Q&A and what have you. But I'm going to start by going back to our three. Hi, Jenny, how are you?
Good, thank you.
I'm going to start by going back to our overhead camera and our three levels. This is the redrawing of Frank Giel's model that we developed. And it basically says that at the landscape level up here, when you get a big shift, you get the possibility of change. But you also have lots of disconnected things going on down here, which can come together to create the possibilities of a new system. And when we talk to a lot of people about what the current systems they work in look like, they often work like this. As Sania Nishtar said, they look at odds. And so really, when I was listening to her, I thought that what she was describing was a situation where up at the landscape level, like here, there was this big change brought on by COVID. There was like a change in the climate or the weather. And going into it, here is your archipelago of government institutions which aren't prepared to collaborate. They're actually often at war with one another. And you've got banks over here doing some things, and you've actually got some mobile operators down here, and they've all got standalone solutions, and none of this is collaborating at all. And so what Sania Nishtar did, it seems to me, is she first of all got the government bits to start coming together and working together so that they moved from being an archipelago into being more like a sort of constellation. She then organized the banks to collaborate with them, and she organized the mobile phone companies to work with them as well. And so you went from having the individual bits of a potential system to then forming what we've talked about before in this series, a minimum viable system. And at that point that she reached, then there's this tremendous opportunity of what this limited thing created in a couple of weeks could be capable of. So the important thing about this three levels framework and all the frameworks is that they're not rigid. They shouldn't be taken as manuals. They're attempts to explain what's possible. So that's that. Perhaps, Jenny, you want to talk then about the role that the four keys that we've talked about before might play in these sorts of situations.
Yeah, so I think in this story, Charlie, the main thing is that there is a massive resource shock. That is what destabilizes the systems that are there and where all the response is coming from. So people's livelihoods are suddenly cut off. They themselves are also cut off. So they can't get back to the villages in the countryside. And then we see very quickly all sorts of flows of resources moving around. So we see a flood of people bringing rations to the labourers. And as Sania says, and we see this sort of palpable unrest starting to happen. And then we see a big cash injection, 1.25 billion from the government, but it's stuck. They don't know how to get it out to that enormous number of people. And then, of course, at the same time, Sania has set up, in a way, a kind of latent infrastructure that's sort of sitting, waiting behind the scenes. There are some latent resources that she's suddenly then able to activate because of this shift in the landscape. So she's already put in some of the digital infrastructure to do some of this, but up until now, it has been blocked by where power is sitting in the system. So that those blockages are unlocked by something that she does to shift the power. So the first thing she does is to make this a demand-based system. So essentially, as she says, she's asking the people of Pakistan to raise their hands. She hasn't been able to do that before. She's suddenly able to do that because of the urgency of the crisis. But it opens up a huge sudden engagement from people out there who are then demanding something that is unavoidable, if you like. You can't deny it. So that's creating a sort of push forward. And of course, what that does later on is to have a sort of generative effect on what's possible for those people to then do once they're tapped into the system. And then the second thing she's doing is sharing power with organizations outside the ministry. So you see this as also a story of opening up the boundaries of the system. She says the solution does not sit inside the ministry alone. So, and of course, what that does is give her the opportunity to make new relationships with people who are both inside the ministry and in different departments, different ministries, but also outside, around a very different purpose. So you would have heard her right at the start saying that immediately that the crisis happened, you had a kind of competing purpose. You had protecting people's health and also protecting their livelihoods. So what she's doing is bringing those two purposes together and saying that social protection is an inherent part of protecting people's health and well-being. And I think that I can see that Kelly has picked up on this in the Q&A, that Sania herself is coming from a background of health-related social protection. So she has the ability to sort of see the vision for this crisis to be an opportunity for creating that new form of social protection that she believes should be much more universal. She's very committed to that purpose. And that's allowing her to configure the resources that are suddenly coming into this new system and the relationships that are needed to distribute this social protection out much more widely than it has been before. So she's making relationships with mobile phone providers. She's making relationships with banks to create new types of accounts, all the shops and the kiosks that people are going to collect their payments. And of course, not least inside the ministry itself, she's really building a different kind of institutional infrastructure that has its own relational power.
Yeah, Jenny, thank you so much. And just finally, let's just touch very quickly on the role that the roles that she played, because we presented this diagram earlier about the key roles that people play. So she was, it seems to me, definitely an entrepreneur. She was incredibly entrepreneurial, and she was also she was a visionary. She could see a real possibility that many other people couldn't see. She is definitely an inside outsider. She's working within systems, but can see how those systems need to work with people outside them to achieve goals. She's an investor. She had that 1.25 billion to invest. She's an expert convener. And she also created many of the frameworks within which this new system could work. And so in a sense, she's also a commissioner, and she's a scaler. She also, by the way, absolutely believes in evaluation, that social programs need to be properly evaluated. And because she could play all these different roles, she enabled people who could play those roles as well. So she was a convener at the beginning, and then she created this huge sort of amplified field in which people could collaborate together to explore possibilities and opportunities. So that's why we think her story, her unfolding story, is such an exemplary one, and one that's worth paying attention to. So at this point, we're lucky enough to be joined all the way from Bangladesh by Anir Chowdhury, and from just around the corner in Copenhagen, Christian Bason. Anir is an advisor to the Bangladesh government and to the UNDP on digital innovation and other issues, being at the forefront of a lot of innovation during COVID. And Christian is the CEO of the Danish Design Centre. Welcome, both of you. Thank you for being with us. Anir, late at night in Bangladesh. Anir, just to come to you first, Sania Nishtar's story is an amazing one, but there's been lots of innovation going on in the context of COVID in your part of the world. Tell us a little bit about a couple of the things that you've been involved in Bangladesh in creating new systems on the fly in the midst of the crisis.
Thanks, Charles. Thank you for having me here. Yes, Miss Dr. Nishtar's story is actually an amazing one, and you just dissected it and put it together again from a systems thinking lens. So that was very helpful. I'll tell one story about this one number that we had called 333. So 333 was a number that we established about 2 years ago to provide information to citizens about government services. So where do I go for a national ID? How much does it cost to get a land record? What documents do I need to get a passport? Things like that. And typically we get a few thousand calls a day into this number, and there is a small fee that is per minute fee that you have to pay. This number has become a small lifeline for reducing child marriage in the last 1 year. So people would call into this number. They never knew that this was really useful for stopping child marriage, but they started calling. This was not part of our design. And we started entertaining those calls. And in the last 1 year, we stopped about 5,500 child marriages, which is a big problem in Bangladesh. People would call in. We would forward that number to the local administration. Within half an hour to 1 hour, people would show up to stop the child marriage. During COVID, it took a totally different redesign. We connected this to our health department because in the March and April timeframe, we had only one test center in all of Bangladesh of about 165 million people. We needed to know where the disease was progressing because there were a lot of returning migrant workers coming back, and they were spreading the disease. And we needed to know. So we opened this up free of charge for people to call in and report symptoms. And we had an artificial intelligence backbone that we created within a couple of weeks with the telcos. And we could tell at least 7 to 10 days in advance where the disease was progressing based on the symptoms they were reporting. And we verified these symptoms with about 200 doctors that would call back for the largest symptoms. So this became our syndromic surveillance tool. Then people started calling to get doctors' help because they could not go to the clinics and hospitals. And we thought that was also a safe thing. So we had a call to action, and about 4,000 doctors joined in about 2 weeks to this call. So it became an Uber doctor model. So this would then forward the call at any hour of the day, at 2 in the morning, 5 in the morning, during the day. We always had a few hundred doctors at any given moment, and they would take calls. So in a day, we would actually get 100,000 calls that we were actually servicing people with COVID and non-COVID treatment options. Then we had a cyclone in the middle of all this chaos. We had a cyclone. So we basically said 3330 would be the cyclone helpline. And people would call into that to actually get cyclone shelter information, and then they could get emergency help. Then we opened up 3332 to get emergency food support. So people could call in for both COVID and for cyclone emergency food support. So tens of thousands of people were supported through this 3332 line. Then Dr. Nishtar's story was one in Bangladesh as well. And we were fortunate to have a similar eKYC connection with banks, the mobile financial services operators, and the mobile telcos. So we used telco data to identify locations for where the call was coming from for health, and also for social safety net. And we had to build a new social safety net payment for COVID. We had about $150 million. So similar to things, it's a smaller amount that we dealt with for about 5 million families. So 5 million meant about 25 million people that we had to reach. Again, the listing was done. A lot of our workers that lived from hand to mouth on a daily basis in the cities went back to their village homes because they could not afford to live in cities. So we had to find them based on their phone numbers. So we did that, and then money was sent, and this money was sent electronically. So we made sure that no cash was sent because that was not safe. So it was done through creating mobile wallets, 5 million mobile wallets in a matter of about 4 weeks. And we had our central bank create an emergency regulation to create bulk accounts. So 5 million new accounts in a matter of weeks. So that's how it was done. Then 3335 was commissioned to create an e-commerce line. A lot of people did not have access to the internet. And even if they did not know how to operate the internet to order food. So what we introduced with 3335 was what we call P-commerce, phone commerce. So they would call in, order food and medicines, and one of the 115 or so e-commerce companies in Bangladesh would actually fulfill that order. So 333 became a lifeline for health, for social safety net, for cyclone relief, for commerce. It became this big helpline for a lot of people. I'll end with just one other thing, if I just have one more minute, which is what we have been trying to work with the judiciary in the last 5 or 6 years and had very little progress. We were able to bring a system that we used for the administration to our Supreme Court. And the Prime Minister and the Chief Justice decided that this was going to be used for virtual bail hearings, because we already had overcrowding in prisons, and we had bail petitions piling up, and we were able to get about 50,000 bail petitions released in a matter of 2 months by just bringing this in. So again, the issue of systems thinking, bringing, basically crossing boundaries, so the archipelago to one system thinking, creating new incentives with shared purpose, and bringing in private sector data. I think that is a very important thing. So just within government, you won't be able to make all these decisions unless you have the private sector come in and help.
Anir, thank you. No, thank you, Anir, for sharing that with us. So I'm just going to turn to Christian now. So Christian, you created and were involved in the start of Mind Lab, which was a fantastic initiative to bring new thinking to the heart of Danish government. What's your reflection listening to Anir and Sania Nishtar talk about the kind of change they've managed to bring about in the midst of this crisis? What kind of lessons, if any, can we draw in this very different situation we find ourselves in Denmark?
Well, I think it's interesting how both the case examples we heard demonstrate how the crisis sort of brings a different level of action and involvement, and also perhaps purpose to some systems changes that point to the future. So currently, as I run the Danish Design Center, we find ourselves also as this type of insider, outsider actor. I very much like the roles we've been discussing this afternoon, where the big challenge is to how do you actually bridge between governmental entities on a particular agenda, and then the resources and capabilities that are in society, and of course not least the end users or the human beings, the people, the families, the communities that you want to serve. And in my mind, the conversation today just highlights some of the things we also when I led Mind Lab we're discussing, which is sort of the connection that we consider in design between systems, empathy, and process. And I think all of those are at play here. So systems in terms of actors and the relationships, empathy in terms of understanding the practices. For example, the case we heard earlier today where it was a question of do the laborers even have credits for their phones, and can they even send a message? not less do people have a bank account. Well, that requires you move into that context, but also the work requires you shift to the very high level context of government actors that also in my experience, my personal experience, are certainly not always aligned. And there's a role to play in creating that alignment. Now, I think one of the big questions is, can we do that without a crisis? Because in many ways, I really have to say a crisis makes it easier. Or perhaps a very, very powerful visionary leader who sets a direction that's, where there's no discussion. One thing we did at the Danish Design Center recently was to work on the future of health and healthcare. This was before the pandemic, where we said, well, what if we involve system actors in exploring alternative futures of where health could become, what health could be, healthcare could be for a country or nation, a society, way into the future, like say 2050, and then allow actors in the system to experience in a bodily way, immersive way, what would those futures feel like. And it's in a sense a way to create a personal, a bodily, empathetic experience of what might happen, and a shared understanding of how context can change, and what we might be able to do around it. And so that becomes a catalyst of strategic conversations about changing the system. Right. And I think there are tools, approaches we have, also drawing on design, that can actually help us, don't get me wrong, do this without a crisis.
Yeah, so let's come back to that question of how you can maintain this, but what in a sense you're both talking about are different strategies to get people to step into the future and to see that possible is different. And Anir's story, I thought, was an incredible story of how that's unfolding. I mean, just to underline a point that might get missed, I suppose, in just this amazing story, is that there is, in both Anir's story and in Sania Nishtar's, incredible use of data analytics to create very flexible responses to individual people in very particular circumstances. So, 5 million families in Bangladesh, 15 million in Pakistan, where you're talking about very small amounts of money that make an absolutely life-changing difference to people. So that's the state and private sector being able to operate at huge scale, but at incredible personalization. So Anir, just back to you. What do you think then is the long-term implication of all of this? Do you think that coming out of this, you'll be able to hold on to this spirit of innovation and these possibilities? And where do you think it could head? What could be possible in Bangladesh as a result of all of this?
I think two very important things have happened. One is the level of collaboration that is actually possible that we don't do because of protocol. We were able to break that down. To give you an example, we needed to get several ministers together to make a decision on social safety nets, because that's distributed across multiple ministries. And typically it would take weeks to hold that meeting. Who's the senior most minister, who will sit at the head of the table, how do we send out letters? This was done in a matter of 16 hours over Zoom, because Zoom doesn't have a head of the table. I mean, it's all distributed, right? So we were able to do that. We had WhatsApp groups where we were making major policy decisions with the telcos, the 4 CEOs, our telecom minister, myself, and the regulatory chairman. So about 10 of us, a WhatsApp group. And we were like making pricing decisions, making it free. And I would send a message. WhatsApp. I mean, it's just incredible. So how much of that would actually sustain, I don't know. I hope the Zoom is sustaining. WhatsApp is actually reducing, because we still need letters and all of that. We did not need letters for 3 months. We did not need letters at all, because you did not have to send letters in WhatsApp. It was just messages. So that was one. Second thing is data, understanding of data, how important data is to make decisions, private data, public data. And that awareness has become so high in a matter of weeks and months that we've been trying for years, and that has happened. So that acceleration, I think, I really welcome that. I call it the COVID dividend, that really happened. And that, I think, will sustain. And we are now re-architecting the whole health architecture for the next 5 years. And all the different health institutions within government and private sector are coming together. So that is sustaining.
So this sense that Sania Nishtar has, that actually, but through COVID, you've stepped into a sort of different horizon, and then an even bigger horizon has opened up. I just want to come back to you finally, Christian, and Jenny, you might help us here. I think there's a question in the Q&A for Christian that's relevant, and there's been some discussion in the Q&A. What is that? Can you help us with what that is? Christian, had you spotted something?
Well, in the Q&A questions, I think that there's this, and I think the examples we heard here this afternoon are really amazing. I think there's the levels that you also have in your model, the micro and the macro, and the ability to connect sort of what does it take in an, and I also write about ethics here in the chat, in an ethical way to influence behavior in a positive way and address issues and problems and challenges faced by people, and then orchestrate, and I think the term orchestration that was also mentioned is key here. Orchestrate resources, and resources are government entities, it's private sector actors, it can be philanthropic and non-governmental actors, it can be other layers, other levels of government. This orchestration that ultimately is all about value creation for someone other than yourself. And I'm pretty sure that for some organizations, at least, that's what I see, is that this COVID-19 experience has made the systems unstable. And instability, or this type of zone of instability, which Donald Schoen wrote about in 1971, The Stable State, that we have to pass through zones of uncertainty and flux to emerge on the other side, you could say. And I think recognizing that recognizing we have to go through those zones of instability and complexity. And I think the big challenge with that is that in most positions, not least in government, the objective is always control. Yeah. And stability and certainty.
Yeah.
And so where it gets difficult.
Yeah, absolutely. So I'm just reading now in the chat some great comments, and Ruth Kennedy says, I'm noticing that one of the effects of the pandemic was to break down the immunity to change, and that's opening people up. And Miguel Quinones says, how can we use systems thinking to diffuse power dynamics in the public sector to enable more daring solutions to emerge? And the question here for Anir, what were the challenges to quickly staff the various phone lines opened up to provide these different supports? So perhaps, Anir, we could just come back to you quickly to answer that question. You created these digital solutions, but actually at the end of those digital solutions, there had to be actual people, this army of doctors who you signed up, for instance. Is that sustainable?
The doctor system was not sustainable. So we don't have 4,000 doctors providing free service. So we now have to pay them, and we can't pay 4,000 doctors. So we have limited that. Also, the number of calls has come down. So now we have a few hundred doctors that we pay now. So for 3 to 4 months, the missionary zeal worked and the doctors worked without pay. But what this has done is in the last few months, we have figured out how to manage a very robust, cutting-edge telemedicine service. Previously, we had about 25 companies in the country providing very small telemedicine service, maybe 50 doctors and so on and so forth. Now, this has become a nationwide service. And now we're re-architecting every single hospital to have a telemedicine service because they need that. So this is short of a small revolution, actually. So that has really happened on the health side.
So that's a lot.
So the challenge was to have.
That's a lasting.
The challenge was to really have these medical facilities. Yeah. Right.
Let me just quickly bring in Jenny, who I think has got a couple of other questions. Just a note as we're passing, but we need now probably to move towards wrapping up, unfortunately. But Jenny.
Yeah, so maybe I can just weave through a few threads that are appearing on the chat. So we love this quote from you, Anir, that Zoom doesn't have a head of the table. And I think Kelly's picking up on this interesting shift from where you usually have competing incentives and shifting that from competitive advantage to collaborative advantage in this situation. And a kind of question here from Zareen about, is it possible for Sania to have done this in this context because she is an inside outsider? And how is it that we can retain that kind of outside perspective? So obviously, Anir, you said she has that convening authority, but a question for the participants, I think, is how to hold on to that. And then Afreen is questioning, why is it always that other entities have to share this with governments? Why is it not felt and prototyped by them, this need for more system innovation? So again, I think that's a question of how do you keep the outside and the inside view at the same time?
We thank you so much for those questions. Thank you, Anir, for joining us all the way from Bangladesh, and Christian for that discussion. Thank you to all the people in our Q&A for those brilliant questions and thoughts. I'm just going to try now very quickly to sum up the week. It's been an incredible week. And perhaps I can just show you our sort of very simple diagram of what we think we've been doing here by going to this overhead camera. So this is our famous washing machine model. And we started the week with a story of Malcolm McLean trying to dream up the container. And we had Karen McCluskey, who was tackling knife crime in Glasgow. We used them both as examples of systems innovation. And we've had some amazing stories. We've just heard today from Sania Nishtar and from Anir about creating systems almost on the fly in the context of COVID. We had Sophie Humphreys talking about pause, transforming the lives of women with multiple children in disadvantaged circumstances. Alex Fox talking about Shared Lives Plus. We had Alat Mansky, who introduced us to the idea of working with an open heart and helping those with broken hearts. Diane Rousson from the Winnipeg Boldness Project with her perspective on Indigenous learning. Alex Sutton from the Paul Hamlin Foundation, who guided us through his investment strategy with Chris Ann Jarrett, one of the people he invested in, with Giulio Quagliato, thinking about, well, how do you invest in the uncertain learning of systems change? And we then had Anna, our own Anna and Jenny, talking about their project, working with people in next work and trying to establish the principles on which change could take place. Behind all of this, these incredible stories, we think are all about practice, and they're all about informing our frameworks for achieving that. And we learned about fire souls, and we learned about infiltrating systems and insinuating ourselves into systems. And we've just had this amazing talk about how a spike in the virus can lead to a spike in social creativity. I just want to mention one person before we go who's been behind all of this, who hasn't appeared, and that's our colleague Johannes, who's made this conference possible with his amazing work. And we hope you've enjoyed all these inspiring stories. They've been brought to us largely because Johannes has done all the legwork to make it possible. And finally, I'm going to bring in our great colleague and supporter and the host of this work and project, Helena Bilila, to say goodbye and thank you. Helena.
Thank you, Charlie, and thank you also to Dr. Nishtar and Christian and Anir for bringing us such an inspiring conversation today, and letting us end this week on a very uplifting note. I think it was very energizing to see all of the things that can be done in very little time, and that it is possible. And also that we've gone from this very different levels. We've been both at the macro level today and during the week at the very intimate micro level, personal level of how it is that we need to reinstall the feelings of love and care again in the welfare state. So with this model of how we speak 3 by 4 makes 12 in systems innovation, we've really covered a lot of ground. I hope that you all feel inspired and uplifted, and that you feel that this week has been able to improve your basis for decision making, because that was what we hoped for in the first place, and that you feel that your grounds for decision making have expanded into new horizons. So thank you all, and we'll get back to you. More events will be coming over the months to come and the years to come. So we hope you'll stay tuned. Thank you.
Thank you, Helena. We're just going to now quickly, before we leave, cut back to Carlotta, our graphic recorder, who's been working busily away whilst we've been talking. And we're going to show you a picture of what she's created. Here we have it. That's Carlotta's rendering of what she's heard, designing for simplicity, raising your hand. Behind these incredible stories, one of the things that I really liked about Anir's story was that he mentioned the central bank. The central bank was involved in this rapid innovation, and so it was important to have all these regulators involved, not just people at the front line, and how much systems innovation is a collaborative effort. So we're going to close off now just with one last poll. So we're going to ask you your views. I don't know if we can bring that poll up, Anton. So here we are. To what extent do you feel more equipped to step into systems change as a result of this festival? So that goes from 1 not very to 5 a lot. How interested would you be to hear more about this initiative? How interested are you in staying in touch? And down the bottom there, what kind of areas do you think are most interesting? What would you be interested in hearing about? So I'm going to let that poll run for a little bit. The whole theme of this has been about encouraging people to step into systems change and step into that in practice deliberately and with a sense of opportunity in the future. So we're hoping that the incredible stories that you've been told this week will inspire you to create your own story, if you like. And we're very keen to hear from you about what we can do to help you do that. What are the ingredients of that? And we think that there are many, many people who want to be involved in this kind of work, and they need to find ways to connect with other people. So I'm just going to give that 5 more seconds to vote. So you've got 5 more seconds to vote on that poll. And there we go. So, so 40% say, 4, 35% say 5. So 75% feel pretty much more equipped. That's quite a good outcome for us. We're pleased with that. And 84% would be interested to hear more about the initiative. So we will, as Helena says, be in touch. We're thinking about how we follow this up. Initially, all the recordings of all the sessions are going to be available on our web platform. You can download them, share them. All of the material will be made available, and we will keep you in touch with our plans. We're interested, as other people are, in changing existing systems and imagining future systems, as well as these other topics about leadership, evaluation, and investment. We'll come back to you with ideas on that. We want to thank you for being with us throughout this week. You'll be receiving communications from us in the next few days by email with blogs and follow-ups and what have you. But we want to thank you for being part of it. It's been our pleasure to host this. We hope we can do it again. We are so thrilled to have such a wide range of people both speaking and listening to us. And so without further ado, it's going to be goodbye for now from Copenhagen, but we'll be in touch. And to end symbolically, I will blow out the candle.